into the room.
Good morning. Good morning. My name is Dr. Komolafe. I'm one of the doctors in this department, in this GP surgery. Could you please tell me your name and your date of birth?
Well, my name is John, and I'm like 40 years old. Hi, doctor.
Oh, thank you. How do you wish I call you for this consultation?
John is fine.
All right, John. Could you please tell me your own words, the reason why you want to see us today?
Well, you see, doctor, I have been having these constant sneezing attacks, and I can't do anything when I'm having them, and it's really causing me a lot of trouble.
Oh, sorry, dear. In order to help you, I need to ask you some questions about this situation. Is that comfortable with you?
Yeah, sure, absolutely.
Thank you. When exactly did you start having this problem? Did it start gradually or suddenly?
I mean, this started like 2 months back. Initially, it wasn't as bad, but now it's just getting so worse. It's happening so frequently.
Oh, I see. Do you think this sneezing occurs at any particular time of the day, or it does have the same severity at irrespective of the time?
I'm not sure about any particular time of the day, but when I go outside, it just gets far worse.
Okay, when you go outside, it gets worse. All right.
That's right.
Is it associated with? Does anything make it worse? Does anything make it better?
I would say not really. When I'm indoors, it's relatively lesser and it's fine, but outside, I mean, even if I have to take a walk, I have these really crazy bouts of sneezes and it's very uncomfortable. But it's not like
Okay,
it doesn't happen indoors, it happens indoors as well.
okay. I see. Is there any other concern? Is it associated with any other problem like
Well,
headache?
no, not really, doctor. But
Okay,
I've been having this running nose as well. You know, my nose is always running.
okay. The next what you come out from the nose, is it mixed with blood at any point in time?
Oh God, no. I mean, it's kind of like, you know, watery.
Okay, okay, okay. Do you have any fever, headache, or flu-like symptoms before or shortly
Um,
around the time this problem started?
no fever, but I would say the sneezing could be flu-like, I guess. But no headache. Just have
Oh,
these really crazy bouts of sneezing.
okay. Do you notice any weakness on your face or in any part of your arm or any swelling?
No, no, not that I've noticed anything.
Is there any lumps around your neck?
No, nothing.
Any difficulty in swallowing?
No, not that I've noticed.
Any change in your voice?
No, not really.
All right. Thank you. I will quickly ask you some questions about your general state of health. Is that comfortable with you?
Yeah, sure.
Thank you. Have you been admitted
Mhm.
in the hospital before?
No, not really. I've not had anything, you know,
Do you have
serious.
any long-term condition like high blood pressure or diabetes?
No, not really. No, I'm
Any
fine. I'm
history
pretty
of
fit.
hay fever? Do you have any history of hay fever? Any recent travel
I've
history?
heard of hay fever, but I don't have it. My brother has it, I would say.
Okay, thank you. What do you do for a living? Do you think this condition is affecting your work?
I mean, that's one of the reasons why I've come for this consultation, doctor. I'm an IT professional, and I find it very difficult to even sit at work. You know, I have to travel to work, and by the time I get there, I'm like always sneezing. I mean, people in the office are calling me like sneezy sneezation at this point.
Oh, sorry about that. Is there
Yeah.
anyone in your household that is experiencing similar problem?
My son has asthma, but no, nothing like this though.
Okay, I see. Thank you. I would like to ask you some lifestyle questions, please.
Okay, sure.
Do you smoke? Do you drink alcohol?
No, I usually don't smoke. And no,
Oh,
not really. Alcohol is also something that I avoid. I like having a healthy
tell
lifestyle.
me. All right. Tell me about your diet.
Well, I try to keep a very strict diet. I'm very health conscious, so yeah, my diet is
Any
pretty
form of
good. I
exercise?
try to keep.
Do you do exercise?
I really don't get much time for that, but
Mm,
I try, but it doesn't really happen that often.
I
2 minutes
understand you.
remaining.
I will quickly do a general physical examination. Then I would like to look into your nose and neck. Is that comfortable with you?
Yeah, sure, absolutely.
Okay. Thank you, Mr. John. From what we've
Mm-hmm.
discussed and what the finding from the examination,
Mm-hmm.
I think you have a case of chronic rhinitis. Though there may be other conditions that may be associated with this condition,
Okay.
possibly nasopharyngeal carcinoma, but we are not, can't give a definitive diagnosis of that. Do you
Uh,
understand me?
I'm sorry, isn't carcinoma cancer?
It may be, but there are some more tests that needed to be carried out in order to
I'm
confirm
sorry.
this.
Wait, hold on. Are you saying that I could have cancer?
I'm not saying that. What I'm saying is that it could be chronic rhinitis or it may be something that is more serious. That is why we need to give you a 2-week referral so that a biopsy can be conducted. Do you understand me? To identify
No,
and
not
confirm the
really. I'm not
diagnosis.
understanding anything. You're saying a biopsy. What is that? What are you
It's
trying to say?
just
Referral
to
to
take
whom?
the process of taking a small sample from somewhere in your nose and giving it to the laboratory to test and to rule out something that is more dangerous. I will give you a
Well, okay.
leaflet where you can read more about
Move
it.
on to the next station.
Thank you so much, Dr. K. So, all right, we're going to be discussing how you did this case. So, right off the top of my head, I'd like to say that that was a very good attempt. And but you need to understand that your marks will be divided. All right, so off the top of my head, I'd like to inform you that this exam is actually divided into 3 domains where you will be marked on data gathering, management, and interpersonal skills, right? I would say your interpersonal skills is pretty spot on. I really like the way we had the conversation, how it was flowing, how you
Thank
asked
you.
me the questions.
Thank you.
Data gathering was very detailed, but if you notice, data gathering just went on for a very long time, right? You're going to get only 4 marks for data gathering, and you're going to get 4 marks for management. You didn't give me any management. So you see, you're going to lose the 4 marks if you don't get to the management fast. So, how long into the conversation did you understand that this was, allergic or chronic rhinitis?
When you said that your child, your brother has something like that, then
Mm-hmm.
your son. But I was looking at two more. I was that okay. Then maybe also need to rule out something that is more sinister. That's why I said that it could also be so that they may be need to carry out a biopsy to rule out something more serious.
All right. But there's no history of cancer in the family, right? But that's all right. So,
Eh?
once
Sorry,
you
I
get
want
to
to
the
ask a
diagnosis,
question.
once
Sorry, I want
you
to ask a
understand what the
question.
diagnosis
Please, I want to ask a question.
Try to move on, because once you understand your diet red flags like lumps, and for that was using the work in absolutely. Go ahead. Yes, Dr. K, you wanted to ask
During
me
the
a question?
exam, thank you. During the exam, is there going to be a clock that one can look at to give an idea of how
Not
one
something
should spend his time?
that you can. That I understand.
Is there a clock? Is there going to be a clock?
I can understand. There are these voice prompts that go off, you know. So you get the voice prompt of 2 minutes remaining, and that's your prompt saying that 6 minutes have passed, only 2 minutes are remaining. Not that you can visually see. You will be only hearing voice prompts. Do you understand me?
Okay.
Am I audible?
Yes.
So I just wanted to say that you don't have a clock that you can visually see, but you will be there will be voice prompts that will be going on. So there are a total of 5 voice prompts that you will have. You will have enter the station. I mean, there will be begin, where you have to enter the station. Then it will be I'm sorry, enter the station will be when you enter the station. Begin is after the reading time, and 2 minutes remaining is when you have 2 minutes remaining. That means 6 minutes have passed into the consultation, and move on to the next station is the last prompt, where you have to leave immediately. You can't continue anything more. Anything more after you say after that prompt, it will be completely dismissed. All right. So there is not something that you can visually see. You can only be hearing all these voice prompts. Yeah. Do you understand me?
I understand you.
All right. So that's why you have to try to have an internal clock. We have incorporated, GMC timer. So you have been practicing with the patient GPT, the simulator. So even that also has a lot of voice prompts, right? Where it says begin, enter the station. So this is the similar timer that we have, incorporated, where if you play begin, see that prompt that you will be hearing. All right. So this is how you get an idea that it's fine, I have to start. And then if you see it's 1.5 minutes, that is that you will have for reading time. So now you can skip this and you'll have the into the room. This is when you start your consultation, right? So now in this consultation, you will have a total of 8 minutes. Now, if you have 2 minutes remaining, you hear it. When you have 2 minutes remaining, another voice prompt will go, you have 2 minutes remaining. So you have to have an internal clock. That's what we're trying to, promote, to do your consultations really fast so that you can get to management as soon as possible, right?
Okay.
So let's understand a little bit about this case. So now if you see, this is the information that you have at the moment. You have the candidate information, which will be outside of the cubicle, and you will be given 1.5 minutes to read this. So all the information you have is John Davis, age 40, concerned with sneezing, no other information. What is your task? Your task is to talk to the patient, assess him, and discuss a management plan. So your task is to find out what the problem is and discuss the management. So if something is given as a task of what you must do in the question stem itself, make sure to always do it, because you never really got to management. So your management part is going to take a really bad hit, right? So out of 4, you might be getting like some 0.5 or maybe 1, because you never really got to the point, right? So let's discuss how we can do this better. So if you see, if you use the workbench, so you have access to this. So you can choose the case from ENT, nose, and this is allergic rhinitis, hay fever. So once you get here, there are 2 modes in action. visualizing the workbench where you can have a practice mode, or you can have case information at the information level. So I'm sorry, there's some technical difficulty, but all right. So case overview, it will give you an idea of what he's concerned about is sneezing. He's experiencing sneezing for the past 2 months. These are the information you're supposed to be gathering. So you've asked the right Socrates and 40 para questions like frequency, onset, duration, aggravating, relieving factors, right? So the 40 para questions would actually give you an idea of this, like past 2 months, it gets worse when he's outside. There he has running nose with clear fluid, but no other symptoms like cough, fever, or itching. Other family members, son has asthma, brother has hay fever, and it is impacting his work. He is an IT professional and wants to improve, his condition and manage his symptoms. That is your task. So out of the questions in data gathering that you should ask me, you should manage to get this much information out. So how do you go about that? So you did ask me the right 40 para questions. That was very good. As soon as you got to the 40 para questions, you need to rule out your differentials. So now the main thing that you did was to rule out the differentials, because why are you ruling out the differentials? If you have a symptom, if you have a presenting symptom, so the presenting symptom is what you see in the question. Mainly the presenting symptom will be given to you in the question. Sometimes it might not be given to you in the question, where the question would be like, just explain to him, address his concerns. It might be very vague like that. But in this case, you have a presenting symptom of, sneezing. So what could be the worst thing that can happen when sneezing, and what is this most likely to be? So in the associated symptoms you're supposed to rule out, you're supposed to rule out the worst things. So you asked me about the streak of blood, if I've been seeing, if I saw any blood in the sputum. You've also asked me about any lumps or bumps or any, red flags like weight loss or any dizziness like anemia symptoms related to cancer. But I said no for that. So you've ruled it out. So you're actually asking these questions to rule out other conditions, right? So you've also understood the fact that there is a genetic disposition, because my brother has had it and my son also has, asthma, right? So it's most likely that it'll be around that side, that kind of a diagnosis. So let's get back to the workbench, right? So the differentials you can actually ask by these tumors. Now, what is this condition most likely to be? It could have also been a polyp. So a polyp case is also very common. So in the polyp case, I would be saying that anosmia, I can't smell things properly, or it's only happening, this running of nose is only happening from one of the nostrils, right? So that you understand that that's a polyp, right? So you would be doing an anterior rhinoscopy to actually see the polyp. So in the polyp cases, you will have a visual finding where there'll be an image that will be given to you. Then you know immediately, all right, yeah, this is a polyp. Let's just call it that. So in this case, there wasn't anything like that, right? So what did my findings say? So if I get into my findings, observations was normal. That means vitals was normal. So there is no, very systemic problem. The ENT examination, throat, there was erythema of the posterior pharyngeal wall and tonsils. So there is an inflammation going on. So it's an acute inflammatory case, right? And there is posterior nasal drip. Posterior nasal drip is basically when you have a runny nose and there might be some mucus that you can see through the pharynx, right? And anterior rhinoscopy was normal. All right. So this was your findings. So in the exam, only if you verbalize on what findings you want to see, then only will they show you the findings. So they have these flashcards with them, or they have these clipboards. If you say the word anterior rhinoscopy, then only will they give you the finding. If they say general physical examination like BP,
2 minutes remaining.
So that was the voice prompt, the 2 minutes remaining. That is the voice prompt that goes off in the exam as well, right? So you know that you have to be in management at that time. Okay, that was just an example. I wanted to tell you about the voice prompt, right? So getting back to the station. So only if you verbalize the examinations that you want to do, will they be giving you a clipboard, right? They'll have a couple of clipboards with a couple of examination findings. So even though the findings are exposed when you say findings in our workbench, in the real exam, the simulator will be having a clipboard. Only if you say that you want to do this examination, will they be giving you the clipboard. Do you understand me?
I do.
All right, great. So like you have to say, I want to do throat examination, then only you will be getting the throat findings. I want to do general physical examination. Try to mention the whole thing, like respiratory rate, heart rate, BP, saturation, and saturation is important because it's a respiratory problem, right? So saturation and temperature, right? So now when you do that, will they only give you the clipboard? But over here, the examinations are all normal. All right, and
Okay.
so let's get back to the workbench, right? So now you've asked me all the 40 para questions. So now you understand the fact that you only have a very limited time. So if you have to distribute your time into doing data gathering and management, try to do equally distributed. Try to only keep 4 minutes for data gathering, because the data that you have to gather is basically just this much, right? Even though you need to understand what you're looking for. You can't just randomly be asking questions, because you'll be wasting a lot of time. So even from the 40 para, which are the important things? Frequency, onset, duration, anything that makes it worse, better, aggravating factors, associated symptoms. These are the important questions. Now, some differentials to rule out the most.
Move on to the next station.
That is the last prompt that you will be hearing. All right. So in the differentials, make sure to rule out the worst condition that can be associated with this, which could be a tumor, any weight loss, or the most likely differential, which is a polyp. You can be seeing that. Sinusitis, you asked me about headache. Good job. Obstructive sleep apnea, that's also something that you can have asked. Like, are you snoring a lot at night? But that's just to rule it out. Even if you didn't ask, that's all right, because you have a diagnosis in your mind. You have a working diagnosis. So once you have a working diagnosis, you need to understand how this is affecting his life, right? So like you did ask that in very good detail, like how is this affecting your life? Like, yeah, it's affecting my work, because you're not only trying to manage the symptom or the disease, you're trying to manage the person who has come with the disease. So understand how this disease is affecting their life, that you can provide them with more help, right? So how is this affecting your life? How is it affecting your job? You asked me about the job. I said they call me Sneezy Sneezerson. But yeah, so that you understand, right? He's having a lot of shame from having the sneezes. So right, so then you understand that, and you try to give the management accordingly. Now let's go to the management. Management, you did all the examination. Provisional management, I suspect. So whenever you're saying a provisional diagnosis, try to be very calm and collected about it. Don't, if you say words like carcinoma, that will get them very agitated. You have to give them a reasoning why you're thinking it's carcinoma, right? And it needs to be a very valid reasoning. All because my brother has hay fever, it doesn't mean that I can have carcinoma. You understand? There's no real relation like that.
Yeah, and be very careful about dropping the C bomb. Like if you mention cancer, it's going to entirely, derail your conversation. You won't get to say anything else, whatever you want to say, because that's something that's very important. The patients, so the only time you actually suspect cancer is if you see weight loss, and if you see there's either weight loss, blood somewhere, bleeding from somewhere, or if there's a history of cancer, and only if you have a strong suspicion. And if it's an elderly patient, you can suspect cancer if very vague symptoms. But as of like wherever it is, it's a relatively younger middle-aged patient, suspect cancer only if you see some specific signs of it. Right? Otherwise, it will completely derail your conversation.
Yeah, that is very true. If you try telling somebody that
I noticed that when I said that, I started asking, do you mean I have cancer? Really is a very good point.
Absolutely, they will actually throw you off, because if you come up with a diagnosis that is not very, in keeping with the symptoms, then they will, and especially if you say something like cancer, that the simulator will go berserk. They will be like, what do you mean? What do you mean I have cancer? I've come with sneezing and you're telling me I have cancer. What proof do you have? Like, even if you think about a normal person, if you're talking to them, like if you say that you have something like cancer, you need to have a very strong suspicion when it comes. You need to have very strong, indicators of that to suspect cancer. And even if you're saying cancer, always say suspect, because you can never be definitive about your diagnosis. You need to do some more further testing to understand, right? So let's look at your performance. So we have a performance sheet of how Dr. Rohit has marked you. So you have confirmed the patient's name, but always make sure when you're confirming the name, confirm the full name. His name is John Davis. You only mentioned John because these are the patient identifiers. You need to be very
No,
confident about.
I said, could you please tell me your full name and date of death?
All right. Okay. So if the patient does say just the first name, I'm sorry, I might have not noticed that, but if the patient just says first name and if you haven't heard the full name from the patient, make sure to repeat that because you need to be very clear about who you're talking to. You could be talking to John Smith for all you know, and you would be having an entire conversation and you might not even know it's the right person. So the identifiers that are given to you, you have to pay a lot of attention to that. So the identifiers of John Davis, 40 years, needs to come out of his mouth, right? So then you know, like, okay, fine, this is my patient for sure, right? So always have, that's why they have, in the PLAB 2 exam, they have a mark for confirming identity because you can't make a mistake with the patient you are talking to, right? It can't be another person because there might be multiple people with the same name, right? So that's not a thing that they'll tolerate. So this exam is to see that if you are recruited in the NHS, on your first day, will you be able to handle a case appropriately without causing a lawsuit to the NHS? Do you understand? So
Yes.
if you accidentally go and talk to another person who is not your patient, then all hell is most likely to break loose. So make sure that you're very clear on your side. So confirm patient name and identity. And initial symptoms, you ask the 40 para questions for the presenting symptoms, the 40 para for the presenting, that's good. Rule out some of the things. You asked me about fever, sore throat. You could have ruled out a couple of them again. Cough, any swallowing problems. Actually, you did ask me all these questions, so we will give you a partial for this. Yeah. So tumors, or you asked me about any lumps and bumps, right? But you could have asked me about, smell, anosmia. Do you have any problems with smell? Have you lost the sensation of smell? Because that's very close to polyp, which could be a case, a differential in this case. And rule out sinusitis, obstructive sleep apnea, poripara, how is this affecting your life? Ice is a very good question to ask. Like ice are the 3 questions that you would definitely need to ask a patient. Like I mentioned, you're not treating the disease, you're treating the person. So you have to ask them what their main concern is so that you can address that. Because as a doctor, you have a lot of knowledge. You can't be giving all that knowledge to your patient. You only want to give the knowledge that they are seeking. So for that, you need to ask them what they're seeking, right? So start with, do you have any idea what this could be?
Sorry, excuse me. All these gamut of things, how do you do it within 4 minutes for data gathering? There are so many things to discuss within. So how do you fit everything within 4 minutes?
I mean, I'm glad you asked me that question because we had the same problem. We had almost a similar problem of how to fit this in. So we made something called the consultation guide. So this is an in-time guide that we made for every case where we actually give you how to do this entire case in 8 minutes. So we have divided the entire case into 30 seconds where you can actually see what to do in that 30 seconds. So the first 30 seconds, if you see, according to the in-time guide, you can actually introduce yourself, you can empathize. So this one feature that we have added onto the in-time guide is, it moves with the timer.
Begin.
So we have tried to make it such that it moves with the timer.
Enter the room.
So as the timer goes, we can tell you, it will tell you which section to be in. So if you practice your cases using the in-time guide, you might be able to, cover the entire scenario with data gathering.
Sorry, how did you get to in-time guide? How did you click the in-time guide? Repeat it again.
How did I click the in-time guide? All right, so I'll just tell you another feature. So if you can't move down the in-time guide as the timer is going, so you just have to pause.
I mean, how How did you click it
How did
on
I
here?
get
In-time guide.
right? So have you checked out the OSCE workbench? You've checked out the patient GPT where you talk to the patient, right? The simulator.
Yes.
So there is another application that you have access to called the workbench.
So where you're selecting practice with AI, on the other side it says practice with partner, right? So that's what will bring you to this.
So we'll just show you, like if you go to TuringMedSchool. Oh, sorry, went to the workbench directly.
No, I always practice with AI.
Yeah. So there is a practice with partner option. You should click that. That will take you to the workbench.
So this is the website. That's right. So if you go into the login, you can just log in.
Stop clicking on.
Okay. All right. So this is your dashboard. So if you
Yes.
want to see the cases, so when you do see the cases, you go to case map and you want to practice the case where you go, suppose if you go into milestones, if you want to practice this not walking at 4 months, you have an option of practice with AI or practice
Yes.
with partner, right?
Okay. Let's
So if
I
you
want to
click practice
with AI.
partner,
Okay. With
that's
partner.
what you usually click. So when you go to practice with AI, you get the avatar and you can speak with the patient. But if you practice with partner, this is if you have a practice partner, you can actually practice with them over a video call like we are doing right now. So what you can do is you can just so this is how you can, if you copy simulator link, if you click this, it'll open a video call, so which you can share with your practice partner and you can practice this case with somebody if you have a practice partner. So
I
practice with
don't have
AI,
a practice partner.
that's all right. That's why we made the practice with AI, so that if you don't even have a practice partner, you will be able to practice the cases. So now in this is the workbench where you can either have a practice mode. So this is the practice mode where you will have a review mode where you will have a case overview of what the case. Oh, so this is how the video call comes, right? I'm just going to drop off over here. This is if you have a practice partner. So you can see the case overview from here on how you should approach the case. There is my performance every time you perform the case. So every time you have performed the case, it will show every date and with the time. So if you've performed it with the partner using the workbench, it will have a different logo. If you performed the case with the AI, it will have a different logo, right? So in this case, you can see every case performance, you can see which ones were covered and which ones were missed, right? And then you have a doctor's instruction, like how we have the Canada info and the finding. And finally, you have the in-time guide, the consultation guide. This is the in-time guide. If you press it, you will get to the in-time guide. Yeah?
Okay.
All right. So that's the workbench. So this was our case. Allergic rhinitis. We will, So the consultation guide, if you see, with every time as you go, you can see every 30 minutes how to start with. Introduce yourself, acknowledge the patient's emotions, ask the presenting complaint. The presenting complaint should be only asked within 30 seconds. So you'll have an idea of how to keep going. Like just ask the relevant questions and move on. So once you get the diagnosis, rule out the associated symptoms. Right, whatever you're thinking in your mind, like polyp or maybe cancer, whatever you're thinking, just rule it out by asking the questions, right? And then any family or allergy history, which is an important question. How is this impacting your life? You see everything. It should be done within 5 minutes.
Yeah, and also if you notice, there's no history, there's no smoking, alcohol, anything is mentioned in this because there's not enough time for that, which is not relevant in this if you think about it, because you already got an allergy history, with the family having the same symptoms of allergy, and there's no weight loss and things like that, so it can be cancer. So we can just rule out. You need to learn to skip, certain questions that from the data gathering. And this will actually help you a lot with that.
So once you ask the ICE, you understand what the patient wants to know. And then quickly summarize by saying that, all right, from what we have discussed, I can understand that you have been having this for 2 months and this has been affecting your life and it's worsening when you go out. And so I'd like to do a couple of examinations. So quickly do the examination, just verbalize the examination. So if you say if the examination, by the time you do examination, you have 3 minutes. By the time you are at 3 minutes, you have to drop the diagnosis. So allergic rhinitis, this is what I think it is most likely. You might be having this. So we've included lines that you can be saying along with, what the diagnosis is. And then you discuss the investigations to confirm this diagnosis, right? You can check the blood level, IgE levels to see what the thing is. And then you start discussing the treatment options. So the treatment that I can give you could include antihistamines and some lifestyle changes, right? Like if it's a pollen, you can close the doors, make sure you wear a mask, right? When you're venturing outside, so you don't get affected by the hay fever as much, because that's what he says. No, when I go out, it's more like try wearing a mask. Let's see if it makes a difference, right? And safety netting, this is very important. So now you have the idea that it could be cancer. So now what if it is, right? So you can't say to the patient that it could be cancer. Instead, another way of saying this is, just in case, if you see that your symptoms are worsening with time, if you see there is blood in your nose, if you see that you have some lumps and bumps that are just appearing out of nowhere, make sure to come to the hospital, right? Rather than making it very difficult for you to do the consultation, you can incorporate it as a safety netting. No matter what the symptom is, always try to give the worst possible scenario in the form of safety netting. That way you can actually help out, make sure you're a safe doctor and you've said what could be the worst thing, right? Safety netting, leaflets, and follow-ups. So follow-up is very important because you have given him a treatment plan, but you need to understand how that treatment plan is working. Is that treatment actually working in his life? That's what you need to understand. So to understand that, you have to arrange a follow-up. So follow-up is very important. And the best kind of patients you have is the self-aware patients. So you want your patients to be educated, right? So you're giving them a leaflet on the diagnosis that they have encountered. So NHS makes like millions of leaflets on every condition because they also want their patients to be very educated. So no matter what the diagnosis is, try to give a leaflets. Just say it saying that I'll provide you some leaflets and some reading material so that you will be better aware of your condition. So these three things we try to tell everyone to incorporate in their management, no matter what, because you will definitely get some management points. Even if you don't, get to the, when you hear 2 minutes bell, try to get these points out. Leaflets and pamphlets, safety netting, and follow up. These are the three things that you have to do, right? If you do that, you will get some marks for management for sure, right? And then finally, conclusion summarize. So you see, it's actually done within 8 minutes. So if you practice with the timer, if you practice with the in-time guide and the timer, it will be actually helpful. So you can actually have this running on one side, and then another tab you can open up the AI and you can have talking to the AI and you can see how the consultation guide is going. That way you will be able to even get it done in 8 minutes. Right, so let's look into the things that you could have done. So the other thing is assessment impact on life. That was very well asked. Examinations also you were done. Suspecting rhinitis, it's a common trigger. Partial because you even dropped the C-bomb, so that kind of threw off the patient. And then what are the medications you can give? And if those don't work, we can also try prescribing you steroids. But how about we try this first? That's something that you can offer for further management. But that's why it's not that important, but you could have mentioned it. And lifestyle changes, avoid parks, keep the windows closed. You could wear a mask, right? Safety netting, return if there is a rash that develops, or if you have sudden headaches, if you see there is weight loss or any lumps and bumps that you can see. Follow up, we'll review in 2 weeks and see how you're coping with the treatment plan that was made for you. Leaflets and pamphlets. And finally, we have 4 marks for the interpersonal skills. So interpersonal skills, I guess you got almost 3, so that was great. Your interpersonal skills were pretty spot on. So yeah, that was a good job. So that was your performance. That was the first case. All right, so now we'll try to keep the explanations a little more shorter.
Please like and subscribe to Turing Med School. Good luck with your preparation.